When you think NICU, that's what you think. You think Dr. Liss.
In York County, countless premature and sick babies have been cared for at the WellSpan York Hospital Level III Neonatal Intensive Care Unit. And it all started with this man.
I'm Jon Liss. I'm a neonatologist, and I worked at WellSpan York Hospital over the last 35 years as the director of the NICU and the chief of newborn medicine for the WellSpan health system.
In 1985, Liss had the task of starting a NICU from scratch at WellSpan York Hospital to be able to offer critical care to the most fragile patients right here in York County.
For us as staff, it's like taking care of a friend. We develop long-term relationships with our families. Many times the babies are there for months.
As Liss recently put down his stethoscope and retired, grateful patients have lined up to give thanks for his life-saving work building York County's only Level III NICU, a place that treats 525 babies a year experiencing conditions like respiratory distress, low blood sugar, and neonatal infections.
I can't imagine the lives he's touched over the years, because I think, I have 4 of my children with me and now 4 grandchildren, and all that was possible because of his work with the NICU and everybody in the NICU. Just a big thank you.
From 1-year-old Toby to 28-year-old twins Rhiannon and Tara, brother Ian, and even Jonathan, every child here was cared for by Dr. Liss and the NICU staff through the years.
It's always a trauma at some level for a family to have a sick baby. There's nothing that you worry about more than your children, and a feeling of helplessness, not being able to hold your baby right away. There's so many different aspects, and the Coopers went through an awful lot of it.
Chrissy Cooper gave birth to twins at 24 weeks back in 1991 in the WellSpan York Hospital NICU. 8 years later, she was back in the NICU again, this time with sextuplets. Dr. Liss was with the family every step of the way.
Having that relationship with him, with the NICU, just made what the insurmountable odds that we were facing just much more doable.
We cry with the families and feel for them and feel with them. We become attached to their babies. So it's a challenge on some days, but for the most part, it's a joy.
He was able to explain things, so that you could understand him. It didn't matter if he was using, 10 or 15 humongous words that you've never heard of before. You could understand them because of the way he explained them.
You walk in as a stranger, and to be able to help a family navigate those rough waters and come out on the other side not terribly traumatized.
It's this roller coaster ride that you're on day in and day out, and whereas your story is so raw right now because you've lived it just a short time ago, but it comes back in waves, and knowing that Dr. Liss played such a huge part in her story, but he played a part in ours as well. He played the part in how many countless other families to get us to this point where now we have these beautiful children growing up and flourishing, and how grateful we are for it.
I get a lot of attention because I'm retiring and because I started the unit, but it's so much more than any one individual. It's truly a team operation.
The NICU at WellSpan York Hospital was expanded in 2018, now with 44 beds. WellSpan neonatologists and nurses can expand the exceptional care that Liss started way back in 1985.
For me, it means that miracles can happen, and that the doctors here at WellSpan are doing so much to keep us kids and babies alive, to help us.
In true humility, Liss's final thoughts?
It gave me way more than I gave it.